Hi, hope your evening is going well. My name is Vincent Pradia, and this is Foundation of Nursing Practice, Module number 6 assignment. I have chosen to talk about scenario number 13 today. The reason I chose this scenario is due to the patient having rehab therapy related to pain and weakness to his left side. Relating to the S bar in question one, my thoughts on the clinical scenario is a scenario that I see often in the medical field. This patient, being 55 years old, was not taught proper body mechanics or proper lifting techniques due to the fact he was lifting a bag of litter and twisted his body the wrong way. This patient experienced what 84% of Americans experience, which is acute back pain due to lifting something the wrong way due to improper body mechanics and improper lifting technique. When you lift with items like that, you want to lift from your legs up, keep your back straight. You want to use your thigh muscles. That way, you're not straining your back. I feel this scenario is very accurate in its description as one personally I can relate to, as I have used improper body mechanics as well, um, as a CNA, from lifting patients and other items to being a nurse and not using proper body mechanics, such as turning my body instead of turning my whole body. So twisting with my back, not a good thing. Gotta turn your whole body to make sure that you're using your body right. While doing the SBAR, I noticed that the patient did not have a lot of things that we would need to have, such as patient did not have his medical history. So in a sense, all we knew that he was in pain at the time he showed up related to an injury he sustained from lifting a bag of cat litter. I feel that we would need to know more about, um, has this happened before, um, what his weight is, what his height is, um, has he had an injury prior. These are things we would like to know due to his age and the type of activity he was doing. Um, it looks like that he did have numbness going on in his inner thighs and groin area, and the pain was going down his left side, which seems to be a sciatic nerve reaction, which is the longest nerve in the body where his pain was happening. The only thing that would concern me related to this is the numbness he would feel, um, if he was feeling it in his feet or anything like that, because I believe that could be related to, um, diabetes or neuropathy, due to the fact a lot of times you cannot feel the pain or anything in your feet if you have these diagnoses. So let's see here. I feel that they should have got the patient should always get their vital signs first. Um, as soon as the nurse goes in and acknowledge who they are, make sure that the patient is who they are. Because with the patient presenting pain 9 out of 10, a lot of times that is showing that the blood pressure will be elevated as well as the pulse due to acute pain or onset of pain instantly ramps up your nervous system to where it kind of puts the body into a fight or flight to take care of the pain to get rid of it. So I feel the S bar, like I said previously, should have added a lot of the patient's history. Um, with that, using the S bar, I would want to know that if the patient has any allergy or medications, due to if the patient's going to be put on pain medications, you want to make sure that he is not allergic to anything due to the different components and compounds in a medication. And like I previously said, his height and weight would be crucial as well to properly diagnose the doses that he would receive. I do believe the SBAR is a crucial tool for not only physical assessment, but as well as mental assessment due to this fact, especially in today's time, um, a lot of mental assessment goes unnoticed or is put secondary to the physical assessment that the person might go through. And I personally believe the mental aspect is as important as the physical aspect because if a patient mentally is stable or comfortable, their healing process will be a lot quicker without any difficulty. Um, I believe if the SBAR tool is used correctly, it is a crucial tool for nurses because it is able to get the answers that as a nurse we might we might need that we might not have either from the previous place they were coming from or from family. So a lot of times to be able to get the answer from the patient, you want to make them feel comfortable in the questioning you ask. And then over time, you can eventually establish trust between that patient and yourself to where you'll be able to get answers to certain questions that you might not previously had. So, um, moving on, if we had this conversation again, what I would do differently is to ask the patient, has this happened before? Um, what were the circumstances? Um, any surgeries or treatments that might have been related to what's going on now? Um, I would refer him back to his doctor, considering that he is in rehab and the pain that he is going through and the progression that he has in therapy is not where we would want him to be at this point in time. So I believe that he might need to go back, speak with his doctor to get other recommendations, not only from a therapy point, but also from maybe a pharmaceutical aspect of it, such as pain medications, if he's feeling any kind of neuropathy, any kind of numbness to the feet, to the legs, maybe gabapentin, which helps with neuropathy pain. Uh, I would definitely request that he has a blood test to establish to make sure that his parameters are there, to make sure he isn't diabetic, to make sure that um, everything else is within normal limits. So there's no other issues that might have to be addressed or that would prolong his healing time. Um, I believe the soonest as we can get the patient in and taken care of with the doctor, the quicker he can come back to rehab to get his strengthening back in his ankle. Um, I believe to get his strengthening back on his left side to release some pressure, maybe off that sciatica nerve, to learn different techniques such as stretching, such as light weight training, and even a proper diet. I believe using these tools will help the patient um, grow from what he is dealing with and progress on to be able to continue a normal, healthy life and maintain his ADLs of his everyday activities. Again, my name is Vincent Pradia, and I thank you. And this is Foundation of Nursing Practice.